Hi, this is Dr. Gombele from drg.com. Today, I welcome you to a new edition, a new presentation in our series of health talk in my YouTube channel. Mwanamboka, Sangoboni, Monganga, Dokotolo Gombele. Yoto Ngamo, Losakomo. Hi, my friend, how are you doing? This is Dr. Gombele. Hola amigo, ¿cómo estás? Te saludo. Mi nombre es Dr. Gombele, Monganga, Dokotolo. You remember in our series of health presentations, last time we spoke about the brain and we went through different strokes. And then we are still on our complications of diabetes mellitus, how diabetes affects human body. Today, we are going to talk about glaucoma. Where diabetics are concerned, they suffer with three principal diseases. One is glaucoma. That is to say, if you are diabetic, you are more likely to have glaucoma than a person who is not diabetic. You are more likely to have cataracts than a person who is not diabetic. And of course, you are more likely to develop diabetic retinopathy than the person is not diabetic. So these are the three diseases that really affect diabetic patients, all right? So I'm going to talk on the first one. Maybe next time we're going to talk about the diabetic retinopathy and the cataract. The first one is glaucoma. What is glaucoma? Glaucoma is nothing than the build-up of pressure in the eye. I like the way some writer put it. High eye pressure. High eye pressure where? In the eye. High pressure in the eye. But when the pressure is high in the eye and then affects the optic nerve, that becomes glaucoma. And most of the time, this is irreversible. But when the pressure in the eye is high, it can be managed, can be controlled. So when you go to the doctor, say the pressure is high in your eye, oh boy, I'm going to be blind. No, nothing like that. If you follow doctor's instructions, you do what is to be done, you will not get to the blindness. But if you don't take your medication, you don't follow doctor's instructions, when the pressure builds up, and they send the pressure to the back of the eye, it affects the optic nerve, surely you will become blind, right? What are the types of glaucoma? We have primary glaucoma. Primary glaucoma is when the pressure builds up in the eye. What makes that pressure build up? The ciliary body produces fluid called aqueous humor. And that fluid, as much as it's produced, so it must be absorbed. But when the fluid is produced and not absorbed, it elevates the pressure of the eye. That is glaucoma. But what makes the lack of absorption of the fluid, we do not know. That's why all the primary causes of glaucoma are the glaucoma that we do not know why. All right? And we have one called open-angle glaucoma, consists of 95% of all people suffering from glaucoma, and we are told that in America you have like 3 million, more than 3 million people suffering from glaucoma. All over the world we have like what, 80 million people suffering from glaucoma. And we have another one, angle closure glaucoma. We have another one, normal tension glaucoma. In this case, the pressure in the eye is normal, but somebody still having glaucoma, right? And the secondary glaucoma, these are medical conditions that lead to glaucoma. One of them is what? Surgery in the eye. If you have done surgery in the eye, you are prone to develop glaucoma. If you had an injury in the eye, you can develop glaucoma. The other one is neovascular glaucoma. The vessels start growing uncontrollably in the eye, So that can also lead to glaucoma. You must get used to me by now. Whenever I talk about a disease, look for risk factors. Because before, doctors used to think, no, the disease are sent by some god somewhere else, you did right. No. We are dealing with now evidence-based medicine. So we must know what we are talking about. Glaucoma, as any other disease, has its own risk factor. Risk factor number 1, high eye pressure, or high pressure where? In the eye. That not glaucoma by itself, it is what? A risk factor to develop glaucoma. The family history. Your father had glaucoma, your mother had glaucoma, your sister, your uncle, look out for glaucoma. Age related. 40 years, 70, more likely you can develop glaucoma than 20 or 30. Severe nearsightedness or severe farsightedness, these are risk factors for glaucoma. High blood pressure, diabetes, high cholesterol, obesity, cardiovascular disease. These are risks of what? Developing glaucoma. Causes of glaucoma: fluid buildup in the eye, and the fluid that builds up increases the pressure in the eye, and the pressure in the eyes now, guess what? It affects the optic nerves, and subsequently problem comes. So what are the symptoms of glaucoma? The symptoms of glaucoma depend on the age, on the stage that you are diagnosed, and then also depend on the type of glaucoma. But the most common symptom is that when you look straight, you see some patchy spot, right? Patchy spot, straight or on your what? Peripheral vision. And then you see tunnel vision. Tunnel vision is when you can only see straight. You are unable to see what is on your both sides. You must be able to see your hands. As you straighten your hands, you must still be able, even though you are focusing before, right? I can see my hands, and being able to see your hand when they are stretched, we call it what? Peripheral vision. People with glaucoma, they do not have peripheral vision, right? They only have what? Tunnel vision, straight, right? And of course, pain in the eyes, nausea, vomiting, a pink eye or redness in the eye. These are the signs and symptoms of glaucoma. And these are going to be diagnosed, these symptoms put together will be diagnosed by the eye doctor. Call who? Ophthalmologist, or the other one called who? Optometrist, all right? So, if you're having a problem in your eye, do not waste too much time, right? Once it doesn't resolve, you better go to see the doctor, the eye doctor. So, when the pressure is up and the optic nerve is intact, you do not have glaucoma. You have high pressure. You take your medication, you exercise, you do your laser treatment, you may never have glaucoma. I know people who they used to put drops in the eyes, right? And then they start following some diet. Some of them came to me, they lost weight, took them off antihypertensive medications, took them off anti-diabetes medications, and when they went back to the doctor said, no, you don't need to come here every 3 months. After doing laser treatment, come to me once every year. And every year they went, there is no pressure in the eye. But why? Because it was diagnosed earlier. While glaucoma cannot be prevented, but can be controlled, the high pressure in the eye. So to prevent glaucoma, you need to go to be checking your eye every year. Because anything in medicine that is detected earlier is always better to manage. Some people go to the doctor and they diagnose them with advanced stage of glaucoma. Nothing can be done, right? They have tunnel vision, nothing can be done. We are closing now. Before we end, I'm going to invite you to like, share, subscribe, and click the notification bell so that whenever I upload my very next video, you will be informed. My diabetics friends, check your eyes every year. Everybody is over 40, 60 years, diabetic or not, go and check your eyes. The best way to find it earlier is to do what? Regular checks. And if they pick it up earlier, the outcome is going to be better. God bless you. Take care. Hasta luego. Au revoir. Mwanamboka. Tikala malamu. Munganga. Dr. Gombele. See you next, where we'll be talking on the complication of diabetes. We're going to continue with the eye, and eventually we're going to talk about the ears and the rest of the body. Bye-bye. God bless.